800. That's CAFE 280-800.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to Let's Talk Hormones with Carolyn Zallmeyer. Take some time with me this evening to learn how to age healthier and live happier. Today we'll be discussing how hormones can affect all aspects of your health and well-being. I've been specializing in women's health and hormones for over 28 years and focusing in on bioidentical hormone therapy for both men and women for the past several years. We talk hormones, we don't talk sex, we talk health, aging, wellness, and relationships, and well, maybe a little bit of sex. So let's get this party started. Good evening and welcome to Let's Talk Hormones with Carolyn Zallmeyer, bioidentical hormone expert. That's me. We're live streaming on Facebook on the Low TE Florida page, live on 95.3 FM and 1470 AM here in South Florida, and also on the iHeartMedia app found under WNN 1470. During the next 30 minutes, if you have any questions for me or for my guest, you can call in to 1-888-565-1470. Or you can send questions in through Facebook. We'd be happy to entertain your questions. We'd love to answer your questions on our topic tonight, which is bioidentical hormone therapy and also aesthetics, looking and feeling good from the inside and out. Please call in or post your questions on our Low TE Facebook page. I've been prescribing hormones here in South Florida for over 28 years. I currently own and operate my own practice, Low TE Florida, which is located across from Holy Cross Hospital on Federal Highway in Fort Lauderdale. I'm affiliated with the Medical out of Texas, and I have studied under Dr. Gary Donovitz, founder and CEO of Medical. He's written the book, How to Age Healthier and Live Happier, Avoiding Over-Medication with Prescription Medications, so utilizing the bioidentical hormones. With the BioT method, we utilize pellet therapy to optimize one's hormones, leading to better energy, mood, sex drive, better sleep, joint pain relief, and much more. I'm currently the #1 provider in Florida, and I rank #2 in the nation. I'm so happy to have with me tonight Rachelle Storm, nurse practitioner, aesthetics, and hormone expert. So, Rachelle, thank you for joining us tonight, and I want to tell everybody why Rachelle is with us. For the last year, we've been searching the world over to find a perfect fit for our practice to help me with the hormone therapy and also to help add in some aesthetics, some injectables of Botox and fillers many of my patients have been asking for. So I'm happy to have you here tonight, Rachelle. We were so happy when we interviewed for her for the position. We had interviewed people from California, Oklahoma, Texas, all over the place. And when she walked in the door and we started talking, we just knew that it was a natural fit. We get along very well, very similar personalities. She's eager to learn and have fun. And so she's added a really nice aspect to our practice, bringing the beauty part of it into it for us. And so we're happy to have you here with us today on the show and in our office as well. So let's get back to hormones. One of the most common questions I'm asked is, what are bioidentical hormones? Bioidentical hormones are derived from plants, and they have the identical molecular structure of the hormones we naturally produce in our bodies. So that little octagon with the lines from chemistry that our body produces is exactly what's in our product. So our body is just kind of convinced that we're naturally producing more and more hormones, kind of turning back the clock maybe 10, 15 years. So bioidentical hormones, our hormones are usually produced in our glands for men in their testes, women in our ovaries. And as time goes on, they start to decline. And it can be a quick decline or a slow decline. But we have receptor sites throughout our whole body that metabolize these hormones, and we need them. Our body needs these hormones to function. Estrogen has over 400 functions in the body. Testosterone has over 100. And so when they decline, we just don't feel ourselves. But we can't quite put our finger on it as to why we don't. So women can start producing less hormones in their late 20s, men in their 30s. I can have a man that's 35 that has a lower testosterone than his father who's in his 60s. So it's not necessarily the chronological age of when our hormones leave the building, but it's more of just when our bodies stop producing it. So despite efforts to discredit bioidentical hormones, the scientific research just keeps getting better and better, proving not only the quality of life benefits, but the health benefits of maintaining your optimized hormone balance as you age. It's healthier to live your older age with hormones rather than out. So that's enough of the science for us tonight. Let's get on to the fun stuff. So why take bioidentical hormones? Well, because they allow your body to feel and function as it did maybe 10, 15 years ago. Restoring your youthful hormone balance is paramount to feeling and looking your best. Some symptoms of decreased hormone levels include difficulty sleeping, waking up at 3 in the morning and not knowing why, lack of energy, just not feeling yourself, lack of sexual desire, and poor sexual performance. Maybe it's not as good as it used to be. Loss of mental focus and memory, and feeling moody, anxious, depressed, any of those things. So how do hormones help make you look good? Well, people with balanced hormones have a better sense of well-being. What's the hard thing to measure, and it's true, is your increased level of energy, your restored interest in life, increased sexual desire, consistency in moods, relief from anxiety and depression, increased mental clarity, and the ability to focus, decreased body fat, and a greater capacity for getting the body in shape. After 50, it's almost impossible to rebuild muscle. You can lift weights all day, and you're just not going to build muscle. You may maintain what you have, but you need testosterone to build muscle. So now we're going to talk a little bit more about aesthetics. We get your body working good on the inside, and we know that estrogen, one of the functions, besides all kinds of symptom reliefs, is it helps support the collagen in your skin. In the old days, when I first started prescribing hormones, I remember my mother and I sitting in a restaurant and looking around at the ladies in the restaurant, and we could point out who had the benefit of estrogen as they aged, because they had the nice, thick, smooth skin. Where the little ladies that look like a little apple you left on your counter for 3 months and it's all wrinkled and crinkly and you look like you could just tear their skin with your finger, they haven't had the benefit of estrogen supporting the collagen from the inside out. So we do that with the hormone replacement therapy. We get the estrogen going and get the skin nice and thick and healthy, more moist and more supple. But then life gives us a few other little things as we get older, maybe a few creases that we don't feel comfortable with, maybe those angry girl lines on the forehead, and a little deeper here, which is aging, and just different things. We may spend a little time in that super mirror of ours and examine things maybe a little too closely, but there's things we can do to get ourselves feeling better about the way we look. We're feeling good on the inside. Now we need to reflect that healthy, youthful look that you feel, because it's a shame when you feel like a teenager but you don't look like it. We're not going to take you to teenager levels, but we'll bring you back about 10, 15 years, right, Rachelle?
I will definitely do my best.
All righty. So, Rachelle, we've determined that hormone replacement therapy helps people feel good on the inside and perhaps want to look better on the outside. When someone comes and sits in the office in your chair for the first time, what do they tell you? What are common things that you hear, and what brings them to the point that they're requesting your services?
Well, first of all, I want to thank you for my introduction and thanking me to join your team. I'm very happy to be part of the team. Secondly, when a patient does come in my office for aesthetics, the main thing they come in is they're not feeling that they feel like they look tired, or they feel like their skin's sagging, or so to speak. But what happens is, as we age, we lose subcutaneous fat, because that's what happens as we age. And sometimes
I think it shifts. I think it goes south.
Absolutely, absolutely. So we need to volumize that back and rejuvenate the skin, so they can enhance what they used to look like in the past.
Mm-hmm. Okay. Very good. Very good. Now, where did you do your training for injectables?
I went to the Aesthetics Institute in Fort Lauderdale. It's been there for 20 years. Sasha Parker owns the business.
A dear old friend of mine for many, many years.
And I'm also an instructor there as well now, so I'm able to give back what they gave me to help teach individuals what I have gained in my career.
Gotcha. So you're actually teaching doctors, nurses, nurse practitioners, and RNs how to do it. So you've got this. You know what's under the skin, because there's a complex muscular structure there, right, that you have to understand when you're putting a needle in there, because you can actually cause damage if you don't do it correctly.
Right. It's very important to understand the anatomy and the dangers and how to alleviate that.
And what I found interesting is that the muscles, say like on the forehead, aren't the same for everybody. There's different, corrugators and all this good stuff I remember from my little training I went through. And so for you to be able to have the gift of identifying the different structures of your forehead versus mine or the patients that are coming in, you look at the whole, I've watched you, and you look at the whole face and you're looking at the asymmetry on one side because unfortunately we're not even on each side, just like, one foot's bigger than the other.
No one is symmetrical. We're all asymmetrical. And that's what the best thing about everybody's individualized. Not one person's get the same amount of Botox as the other person or Dysport, so to speak.
Very similar with our hormones. We
Correct.
don't, everybody, we personalize the dosing. So you're personalizing the treatment plan for each patient with you're looking at them and making the recommendations and listening to the patient as to what their concerns are.
Exactly.
Do you have them look in the mirror and point out?
Absolutely. They look in the mirror, then they always ask me, what do I think? But most importantly, it's what they think and what they feel.
Yeah.
After they tell me what they think and how they feel, what they want, I will give them my honest expertise advice. What I feel will enhance what they already have. I don't want to change the way a person looks. I think it's important to keep them looking the way they are, just enhance the volume, so to speak, that they've lost. Or, the lines and motions that they can't stand, like the 11 lines that you were talking about before, or the paragraph lines on the forehead, or the crow's feet. Even the bunny lines. There's many areas that we can treat that when you make the little bunny lines in those right here. So
You want me to make those for you now?
yes, please. See,
I got bunny lines. She's going to
we're
fix
going to
them.
fix that next week.
We'll have a
Absolutely.
good time. That's great.
And then, like with the fillers, dermafillers, what is great about that is it adds volume back to restore your youth, because volume equals youth in my mind. We start looking, when you start looking hollow, you start looking older, and then you look tired. So a lot of people complain that they look tired, especially through the mid face right here. So it's important to enhance the cheeks right in through here. That helps give a nice lift and volume to the face.
Excellent, excellent. So what is the difference between, say, Botox or Dysport and a filler like Restylane or Juvederm?
Okay, so there's two different companies out there. There's Allergan, who owns Dysport, and Juvederm. Botox is a neuromodulator, which is a neurotoxin, and how it works is we have nerves, we have muscles, and we have nerves, and there's a neurotransmitter tells the muscle to move. It stops the neurotransmitter, tells the muscle to move for a brief period of time, about 3 to 4 months. So it is an upkeep. You have to keep it up every 3 to 4 months. In order for it to work correctly, it's best to keep it up every 3 to 4 months, or you'll start back from zero.
I think your pellet kicked in. You're talking awfully fast
I
here.
apologize. I'm a little ready to go.
Yes, you did. Oops. HIPAA violation.
My pellet is kicking in.
Oh, that's great. So basically, Botox and Dysport are kind of in the same category as...
They're both neurotoxins. They're just
Right.
owned by two different
Gotcha.
two different pharmaceutical companies.
And the filler is basically hyaluronic acid, right?
Hyaluronic acid. It just adds volume or decreases fine lines.
Gotcha,
Yes.
gotcha. Well, that's really great. How quick would you see the results if you were to get Botox or Dysport injections?
Every individual is different, so it can sometimes it can kick in 2 to 3 days, but the average is 5 to 6 days, and the max 2 weeks. That's why I always have people follow up in 2 weeks, so they come back in for a 2-week follow up, and I always touch them up if they need to.
Gotcha. And then with the fillers, that's more of an immediate
Fillers, you definitely
right?
get an immediate result, and how long it lasts pertains to each individual. It depends on your metabolism, how well hydrated you are, because we naturally have hyaluronic acid in our body, and if we're dehydrated, our body will absorb from it.
Gotcha.
And it depends upon what area in the face that you inject.
Right.
If anything below the nose that's in constant motion does not last as long as anything above the nose, through
Especially
the
if you
cheeks.
talk as much as I do.
Or talk as fast as I do.
There you
My
go.
lips are already gone.
Yeah, they finished the sentence a while ago. So basically for the neurotoxins, the Botox and the Dysport, you do like the crow's feet around the eyes. You do the angry girls, I call them, the 11s in here.
And then
you
the
do up
horizontal
here.
lines. Yes.
And then do you ever use Botox down here?
Yes,
or-
you can put a little bit of Botox around the upper lip to pull up the upper lip, and then kind of help decrease the fine lines. It's called smoker lines. Even if you're not a smoker, a lot of people, maybe the way they talk, or maybe they use straws, so they create those lines, whistle lines, so to speak.
Gotcha. Then is there something with the chin?
Yeah, we can get the orange peel effect when you on the chin, so you can put a little bit of that. That also will help make your bottom lip look bigger too, because it'll pull down your bottom lip as well.
Gotcha, gotcha. And then the fillers, that's a whole different category. You use those for the nasolabials.
Yes.
I'm trying to remember this. The marionette
good.
lines,
Yes.
lips, in case we want a little plumper
Yes.
lip. Anywhere else? Oh, is there
You can
anything?
definitely do the cheeks. You can do under the eyes, as a tear trough. Sometimes we get sunken hollow eyes. Not everybody's a candidate for that, depending upon if they have too much fluid underneath their eyes. They're not a good candidate. We could do the marionette lines, turn that frown upside down, nasolabial folds, the lips, like you said, the really fine lines, smoker lines around the mouth. You can also enhance little fine lines all over the face, but I would recommend microneedling for that as well. We also do microneedling as well.
Tell me about microneedling. I'm curious about that.
Microneedling is a collagen reboosting procedure that these little fine points go into the skin, and it's like controlled trauma to the skin to turn the skin over. It helps decrease pores, fine lines, and rejuvenate the collagen. And you would do that 3 treatments, 1 month apart.
So basically, the little tiny holes stimulate the collagen to kind of snug everything up and
Tighten the
resurface.
Skin. Correct.
So that you may have, will you have a little peeling after that, or no?
You don't necessarily get peeling. You'll just see your skin just starting to reabsorb and look much more fresh. So
nice.
I wouldn't necessarily say peeling.
Nice. Now, I've heard you say the term microblading. That's different than the microneedling, right? Or did I get it wrong?
Microplaning.
Microplaning.
I'm sorry, dermaplaning. Dermaplaning.
Okay.
We have microdermabrasion.
Right.
Which is like you're kind of like taking an instrument, which we use suction at the same time, and then like a little grid that we're suctioning the face and kind of like not necessarily sanding away the skin, but it kind of like
doing
helps,
that, yeah.
Resurface the skin as well, like you're sanding a floor, hardwood floor, kind of like
cool.
so. But it does not hurt whatsoever.
Okay, and then the
dermaplaning is we take a scalpel, which it sounds terrible to say a scalpel, but we lightly scrape the fine hairs and the skin cells off the skin. So
nice.
give it like a smooth baby butt.
Yeah, that's what I want.
Yes.
Okay, very good. We have a special. Let's not forget to talk about the special for Valentine's Day. I believe they have a flyer they're going to post up there so you can see it. But we have special pricing now through Valentine's Day this year. You can call our office, 954-791-4498, or email us through lowteflorida.com. There's a place to put in a message. But Dysport, it's buy 2 areas at $200 each and get a 3rd area free, and you save $200. Wow. Derma fillers, buy 1 syringe at the list price and get half off on the 2nd. So you save up to $350. Now, the corker here is that the offer expires on Valentine's Day, so you need to act if you want to get in on this, and you also want to look good for Valentine's Day. So you can call our office, 954-791-4498, and set up a little consultation with Rachelle, and she'll take a look at you and see what she has to offer that might make you feel like you're looking your best. Your age is matching up with how good you feel inside you. So what else do you have that you do, Rachelle?
Well, I do want to say, though, with the hormone therapy treatment, you do feel good inside. I will find out soon. Obviously, you guys know I have a pellet in my booty now. But when you look good on the outside, you feel good, too. So it's a great combination.
Yeah.
So
I always feel happier after Botox.
Yeah, you just feel
like
like you look
lift.
like, and the thing is, you want to look like, people will say maybe you look well rested. And, so that's the great thing about it. So I just feel that you can always start just by one thing. You don't have to do everything at once. Just see how you like it. Just test it out. Just do one area of Dysport or Botox, see how you like it, and then we can go from there.
What's a recovery time for? Will we notice a different, or will we have any problems?
Well, there's no really. The only thing that you may get a chance of anytime you inject yourself with a needle in the face, or anytime you get an injection by a needle, is traumatizing your skin. Of course, is swelling, bruising. That's basically the only thing. Maybe a little tender.
Right.
But that's it.
But for the most part, not.
No.
That's kind of rare. No. Okay. Very good. Do men do these therapies
I actually have
too?
a lot of men, believe it or not. I have a SWAT team. I have a lot of men.
A SWAT team?
SWAT team. You'll see them coming in. Police officers come in, and they definitely, we have all kinds of men. So
Excellent. And men, what do they tend to go with? More of the...
Men definitely do the Botox, and definitely they also like to do their jawline, because sometimes they have that kind of sunken in right here in the tear trough as well, that they feel that's aging them. They want the jawline. Or not the jawline,
so when you do the cheeks, it kind of lifts things up a little bit? Neat.
Yeah, and then sometimes the men want their upper lip. Sometimes their upper lip is not as big as the bottom lip, and they want to kind of like even out their lips, believe it or not. But you can do it subtly where it does not look like they've had anything done.
Right.
That's the key.
Now, there's several different brands of fillers, but what are your favorites? Do you have favorites for different parts of the face?
Yes, absolutely. So I like Galderma products, Restylane. Restylane Refine for under the lines, Restylane Lift for the cheeks, and Restylane Refine or Define for the lips. Juvederm, I like Vabella for the fine lines around the lips. And I also like Juvederm Voluma for the cheeks as well.
Gotcha. Okay, so there's several to choose from, but you know what's best for each product.
There's
Now,
different size molecules
one thing I've enjoyed, I've watched you do a presentation or two, and I like that you're very responsible and you won't do something that's not right for the patient if you feel that there's a health benefit or problem, you know, that if their vascular system isn't right, or the too much fluid under the eye, or they come in and want these great big old lips that you know you don't want your name associated with.
Right. I will be honest with people, and I'll say what I feel that they need, and if it's going to be anything of a danger to them, it's not worth it.
Exactly.
So there are people that will inject areas that are very dangerous, which I will not, and I'll just tell them the truth. What I won't feel comfortable for, I'll recommend them somewhere else who may will.
Yeah, I remember I worked with a cosmetic dermatologist back in the mid-'80s, and back then the big lips started coming in, and we would see ladies leaving there with these, like, and I'm like, oh.
Mamba jumbas.
You're never going to whistle. How long do dermal fillers usually last?
Well, it depends, like I said, the area. They can, like around the lips or anything below the mouth, 3 to 6 months, sometimes up to 9 months. Anything in the cheeks above, cheeks area, up to 6 to 9 months to a year. It just depends on each individual. It really does, on their metabolism.
Gotcha. A lot of our current patients listen to this show. And
hi, patients.
You'll get to meet Rachelle when you come in if you haven't already. She's absolutely delightful.
Likewise.
But can they tie in a consultation when they come in, say, for a pellet or a lab draw or whatever?
Absolutely. I'm always available. I would always take my time to stop and talk to anybody. And I definitely will give a free consultation.
Absolutely. Great. And then, and
I'm there 5 days a week, so they have ample amount of time to make an appointment to see me. And we do work one Saturday a month as well that I'll be available.
Yes. Excellent. I work that too. So you feel like it's a good tie-in with the hormone replacement
Absolutely.
therapy.
Like I said, you feel good inside and you feel good outside, and you have a whole well-rounded feeling,
Gotcha.
Like I said, I can't wait till my pellet kicks in.
What if somebody had fillers and then had regrets and thought, I thought I wanted my bottom lip to be much bigger, but now, a day or two later, I'm not really liking it.
Well, that's great because we do have an enzyme that dilutes it instantly into water. So and that's why I like what we use, hyaluronic acid. So it definitely can be reversed.
Okay. So now we talked about doing the consultation on the same day visit as when people would come in for their pellet or their lab draws or whatever. Can you do a procedure on the same day that a person gets their pellet? Or
Absolutely.
Okay. Excellent.
Absolutely.
Okay, great. Now, about you. Do you have any children?
I do. I have a 26-year-old daughter who I'm so excited to go fly into Ohio tomorrow to see, with 2 granddaughters, a year-old granddaughter and a 5-year-old granddaughter. And that's basically my life there.
Well, I happened to see a picture of her daughter, and she's absolutely stunning. The two of those two doing a selfie together. It's like, oh, my God.
Thank you very much.
Yeah, she looks just like her mother. So Rachelle is located at our office, which is at 4540 North Federal Highway in Fort Lauderdale at Low TE, Florida. And she's trained with the BioT method, and she understands not only the science behind it, but how to do the procedures. And she's been doing procedures at our office. And if I'm not available, I hope you welcome Rachelle. She's been an absolute joy to have around in the office. We've been having an interesting time with the supplement sales these days because we've reduced our prices. So if you take any of our BioT supplements, we have reduced prices on our website. You could take a look and see if you want to stock up on anything, because I'm sure the low prices aren't going to last forever. Also, if you'd like to order this book from that Dr. Donovitz wrote, Age Healthier, Live Happier, Avoiding Over-Medication Through Natural Hormone Balance, you can get it for free from our website. So you just go onto Low, L-O-W, T as in Tom, E as in Edward, Low T-E, Florida, spelled out, .com. And there's a place in there if you scroll down to order the book. And there's no charge, and we'll get it out to you in the mail. Also, if you're interested in any of the supplements, I have little videos on the page, in the shopping cart area, and you can learn more about them and see if they're right for you. And then you can actually place your order on the website. We have a little shopping cart where you can check out and do that. So we have patient seminars at our office that are a lot of fun. Usually We have one coming up, I think, on the 12th, on the February 12th. Yeah, so if anybody's interested, call our office, 954-791-4498, or go to our website, lowteflorida.com. I thank you all for joining us and learning more about aesthetic therapy and how it ties into bioidentical hormone therapy. So thank you for listening, and feel free to call my office with more questions. Have a great night. Thank you, Rachelle.
Thank you.
Thank you for listening. It's my mission to help men and women live their best lives, and I hope that today's show gave you just a little motivation to do so.